Hello and welcome to yet another episode of Doctors In. Today we have with us Dr. P. Jaisankar, who have been specialized in chemical biology and drug development. Let's welcome him to the program. Welcome, Doctor.
Hello, thank you.
First of all, we would like to know more about you.
I am a chemical biologist I'm a scientist working in the Indian Institute of Chemical Biology, which is one of the CSIR research institute situated in Calcutta. I am working there as a scientist since 25 years, conducting research in the field of drug development for the various diseases, especially cancer, anti-Parkinson, and Leishmania donovani, other infectious diseases.
Okay.
Yes.
What are you focusing on currently?
Currently, I am focusing on the lead molecule development or identification from both natural as well as synthetic origin.
Okay. What made you come into this field?
Yeah, this is very interesting. Actually, I would say that made me to come into this field is my profession, of course. There is no doubt, but there is people suffering all over the world because of the lack of the proper medicine without having any side effect.
Okay.
And that is the main reason why I have chosen this field, actually. And then fortunately, I could get an opportunity to get into the premier research institutes in India.
For how long you have been into this field?
So 25 years I am in this field.
So now could you tell us some memorable moments in your research?
Yes, I would say that I am proud to be associated with the Nobel laureate Professor Noyori of Japan, where I did one of my postdoctoral research fellowship studies under him. And in fact, association with Professor Noyori has taught me, changed my life in the research field, in a big way. Oh, it's fine. I cannot really forget the whole moments, whole experience with Professor Noyori.
What is your suggestion about the modern world of drugs?
Yeah, it's good actually. In fact, this is what our CSIR is also focusing in India, that it should be a open source drug discovery, like open source in the computer software, like open source code, Red Hat Linux, the Linux operating system. So the drug development field also should be license free, patent free, etc. So for that, actually, the government of India as well as the CSIR, my organization, has initiated a unique program called Open Source Drug Discovery.
Okay.
Meaning like that the field is open. It's given to all the people who are engaged in the gamut of drug development. They can come and sow the seeds and then harvest it. So nobody owns the right. Neither the owner of the field nor the person is actually seeding the. So the concept is like that. So anybody who is engaged in the drug development should be able to come and develop a particular compounds or drugs for a particular disease like tuberculosis, malaria, etc. So these two areas right now CSIR is focusing. So naturally, it is open to all. Even this particular program is open to all the college students and scientists. So anybody can participate and then contribute into this program development. And this should be the approach to the modern drug development field.
Okay. Could you tell us about some of the neglected diseases?
Okay, this is very important questions. Actually, it was neglected, as you rightly told. There are many diseases like poor man disease or neglected disease. No pharma company wants to invest that money to make the drug because they are not going to earn anything out of that. So one such disease which is prevalent in many countries is Leishmania, which is a parasite. These people who are living in the forest area are affected by the sandfly bite. This parasite is transmitted through sandfly bite, and then the people are affected and it leads to the death. Actually, there are kinds of variety of leishmaniasis reported. So in India, we are having four states in the northeastern states are affected, West Bengal, Bihar, etc. So there are about many people who are suffering from this disease. No pharma company is able to make the drug. And CSIR is focusing on this particular field actually. So government has to make initiative fund generously for developing the drug for these diseases.
Okay.
Yes.
So what are your future plans in the field of chemical biology and drug development?
Yeah, my future plan would be rather restricted myself to the so far the cancer. So I'll be focusing on the neglected disease development, drug development of for the neglected disease also.
Okay.
But we have already established quite a number of vegetable as a good source for the drug for the leishmaniasis. We have been working on this for about 6 years right now, and we have identified the active drug from the eatable vegetables. So instead of giving a vegetable to these populations who are really affected with this, so we can also give these medicines which is available freely. We can make it very easily. So this will be my focus.
What is that you want to do to the society?
We want to develop, rather I want to develop the drugs which are affordable to the society, to the all kinds of people, not in an affordable way.
So lastly, what is a message that you would like to give to the audience?
The message which I would like to give to the audience is that people should also try to go for alternative medicine instead of going for a traditional way of allopathic medicine also, so that we can avoid a lot of side effects and permanent cure for the disease.
Okay.
We should also focus.
Okay, doctor, that was nice talking to you. Thanks a lot for being a part of our program.
Thank you so much. Thank you.
So that was Dr. P. Jaisankar with us. Until we meet next time, this is me, Naina, signing off. Take care.
Sorry.